Again, I want to welcome everyone to this very exciting presentation from Public Leadership Institute, a special presentation of new polling results on proactive abortion rights policies. My name is Dave Woodward. I'm the National Network Director for the Public Leadership Institute, and I will be your host as we go through today's presentation. I want to bring us a couple things to everyone who's joining us around the country's attention. You can always go to our website to get a host of publications. Public Leadership Institute is a nonprofit, nonpartisan policy and leadership development center focused on advancing social and economic justice. A core project of Public Leadership Institute is what you see on your screen, a playbook for abortion rights, a guide for state and local policymakers, as well as a companion edition called Medical Equity Now, model legislation for revealing the hypocrisy of abortion restrictions, working with policy leaders around the country at the state and local level to advance policies that not only advance equity and equality, but protect abortion rights across this country. You can get both of these publications at publicleadershipinstitute.org. You can download them directly, or if you would like some hard copies, we do have that ability to get them mailed out to you, and feel free to reach out to us, and we'd be happy to get copies of the publications to you. The agenda for today's session, pretty straightforward. We're going to go through a couple introductions of our panelists who will be presenting this afternoon, followed by what everyone I think is joining us around the country to hear is some of the new polling research around this topic. And then we're going to open it up to questions that you might have, clarity questions, how this information relates to the work that all of you are doing, and how we can use this information to advance these ideas. You also should be able to download a polling memo that's directly attached to your control panel as you're joining us, and so that a lot of the content that we're going to talk about is captured in there, so feel free to download that as well during the course of the presentation, and definitely use it as maybe a guide to help formulate some of your questions. When we do get to the question and answer period of time, and I will remind folks again at that time, you have the ability to raise your hand by clicking on the hand icon on your control panel if you have audio capabilities, or you can type questions in the question bar at any time, and we will try to get through as many of those we can in the time allotted. So without any further ado, I want to introduce our panelists who are with us today. Gloria Totten, President for Public Leadership Institute, and my boss, and Selzer, who's the President of Selzer and Company, one of the absolute best pollsters across the country that's going to present her information. For those who are less familiar, I want to just kind of read a quick little bio about Gloria. Gloria Totten's got really more than 20 years of experience directing nonprofit organizations and leading grassroots campaigns at the federal, state, and local level. She led Progressive Majority from 2001 to 2015, served as the political director for NARAL from 96 to 01, and as executive director of the Maryland NARAL from 93 to 96. In her home state of Minnesota, Gloria worked as the education director of pro-choice resources, president and lobbyist for the Minnesota Coalition Against Sexual Assault, and media chair for its time Minnesota. And Gloria serves as chair of the board of directors for Brave New Films and as a board member for the New American Leaders Initiative. She brings a wealth of experience not around this topic, but around organizing causes aligned with our values. And I wanted give the floor to Gloria if she's able to join us. But I think Gloria is going to join us a little bit later, so I'm going to hand the mic over to Bernie Horn, who is the Senior Advisor for Public Leadership Institute, to help set this up, and then I'll introduce Ann.
Thanks, Dave. I wanted to make sure everyone knows that we're recording this and that sometime after we're finished, we will send to everyone a hyperlink that allows them to access this this webinar, so that anyone who was unable to be with us today will have, be able to see the whole thing. Thank you all for taking the time to be on our call. Our purpose is to brief you about our new poll and give you the opportunity to talk to the pollster directly. But first, I just want to give you a little context. Public Leadership Institute works directly with a network of about 13,000 state and local progressive elected officials, including about 2,400 state legislators. We provide them with policy briefs, model legislation, and messaging advice on a very wide variety of issues. We also hold National Conference of State Legislators in July. We exhibit and speak at national conferences of elected officials throughout the year. We travel from state to state giving policy and communications trainings. As part of this, as Dave indicated, we have a special project to support proactive abortion rights policy. And as I hope you know, as Dave indicated, PLI worked with many prominent reproductive rights organizations to create a book published last December that contains 29 proactive model abortion rights bills, and that resource, called A Playbook for Abortion Rights, was distributed to thousands of legislators and advocates in every state, and it's also available to everyone on our website. And if you don't have a copy and you want a hard copy, just email me, bhorn, B-H-O-R-N, at publicleadershipinstitute.org. We'll send you as many copies as you like. This poll tests the popularity of 12 of the proactive models in the playbook, plus a 13th concept, which is kind of a generic bill to repeal waiting periods. As you'll see, nearly all of them are popular, and some of them are wildly popular. Now, we understand that even if a bill is popular, that doesn't necessarily mean that advocates or policymakers can introduce it in their given state. Everyone has different circumstances. But popularity is an important factor to win political battles. We need to consider not just the policy, but the political strength of our initiatives. So with that, let me turn it over to Ann to present the numbers, present the poll, and then we'll open it up for discussion, and I expect Gloria will be with us by that time.
Great. And then before, Ann, before I hand it over to you, let me give you the formal recognition and introduction. Everybody, we are incredibly fortunate to have, like I said, one of the absolute best pollsters across this country that worked on this project with us. Ann Selzer is the president of Selzer and Company and pollster to the Des Moines Register and Bloomberg Politics, brings to this space 3 decades of polling experience, claims to have the most linear career track of anyone in the profession, has completed her doctoral work on political communication and polls at the University of Iowa in '84, spent time in a couple research shops, and joined the staff of the Des Moines Register to run their prestigious Iowa poll, and then stepped down on her own in '94. Many of you probably know her. Every presidential election runs through Iowa, and her track record of accuracy in election polls in Iowa specifically, but across the country, really has resulted in her A+ rating from Nate Silver's influential website, FiveThirtyEight.com. We sought out the best to get the best information on this project, and that person is Ann, and thank you so much for being with us.
Oh, it's really my pleasure to be here. And if I click on my
icon hand it over
here,
to
you're going
right
to
now.
hand it over to me.
I hand it over to you. Where did you go? There you go.
Am I good?
You should be good. Do you see it?
I do see it. Thank you.
All right.
Okay. Well, it's a pleasure to be with you all today, and I have been thinking about you since we first started talking to the Public Leadership Institute months and months ago. So you've been on my mind. This day has been on my mind. When you first approached me, it was to talk about language for legislation that would deal with abortion rights. And my first reaction is, this is a treacherous topic. This is the kind of topic, and I probably don't have to tell this audience, that small changes in wording can produce a big difference in the outcome as you poll it. So it is treacherous ground for any pollster to tread on. So I was curious about what the mission was here. And when we started talking about model legislation and testing how the public would initially perceive of a select number of model bills, it became clear to me this is less about the technicality of the legislation, of the initiative, the policy itself, and more about the idea that is being presented forward. So that helped in terms of how we were going to formulate the language on that, and I think overcame an obstacle that had worried me about our ability to get a true read. And really, I'm all about that true read. The other challenge, though, is when you have a poll that as we were designing it, was going to be specifically about removing barriers to abortion and finding ways of increasing access, that you can manufacture the outcome if you're not just terribly vigilant. That is, the people who will stay on the phone for a 12 to 15-minute interview all on a particular side of an issue, well, there might be people who drop off who aren't so favorable, and so you but with no intention, can skew your results. So I hearken back to the mid-'80s when I was a pup of a pollster and doing a freelance project for a jury consulting firm, and they gave me the data from a 45-minute interview about transcendental meditation. And one of the immediate findings was that more than half of the people in the counties where we were conducting the survey had some personal experience with transcendental meditation, which I found not reasonable. And I did find reasonable that the people who would stay on the phone for a 45-minute interview about transcendental meditation, that a majority of them might have personal experience with the topic. So in the back of my mind, I'm thinking about, how do we keep everybody on the phone? I want clean reads on how they are reacting to these bills, so that it's not just those who are already in your court. And you'll see that we did something unusual about halfway through the interview, and allowed people who we had already determined to be sort of situationally opposed to increasing access to abortion, an opportunity to opt out of some questions, but to stay on the phone and be counted, so that we had that clean read. Yeah.
I just want to jump in. Is like, did you accept control to take the presentation? People can't see your PowerPoint presentation.
How's that?
So that is perfect. Yes.
Okay.
Thank you. I'm sorry. I was just, there we go. We're good.
We should have rehearsed that moment. Okay. Well, I hadn't gotten into the slides yet, so
I knew that. That's why I was waiting for my break-in moment.
You've missed nothing. So with that, let me walk you through what we did, and you can see the results. I highly recommend that you download the PDF that is there for you. This was a poll about language, and so this presentation truncates a lot of the questions that we asked, and you'll be able to see in that PDF what exactly the language was. So we interviewed likely voters. They were for the general election this November, age 18 and over. 1,003 of them. We wait back to census data in order to give a true read of the right proportion there, both landline and cell numbers, and we did this in mid-August. One of the first things we wanted to get was the lay of the land as regard to abortion decisions. So the Texas decision had recently come down from the Supreme Court. We asked a question about whether they approved or disapproved of the Supreme Court's decision to roll back the restrictions that have been made on clinics and providers in Texas. And you can see 55% said they approved of that, 37% disapproved of that. Didn't know what to expect, but that looked like a finding that was interesting. For each of these, I'm going to give you regional breakdowns: the Northeast, the Midwest, the South, and the West. In almost every case, it is the Northeast that is the most supportive, and in many cases, it sort of fluctuates between the Midwest and the South that would be least supportive. But you can see on this question, even though it's 55% overall, in no region does it fall below a majority. We also asked about an interest in overturning Roe versus Wade. And you see here that just 27, about 1 in 4, said yes, in fact, they would like to see it overturned so that all abortion is illegal again. 2 out of 3, 69%, said no, they're not in favor of that. And again, you can see those are big numbers for each of the regions. So the idea of sort of the overall mood of the country with regard to decisions at the Supreme Court level is in favor of keeping abortion legal. We wanted to press farther and really kind of get a scale of how strongly favorable or strongly opposed to increasing complete access to abortion. That would be a 10 on our 1 to 10 scale. And 1 means totally opposed to all abortions. And this pie chart shows you how people panned out. And the thing that struck me immediately, that the people giving us a 1, 2, or 3, that adds up to 28%, which is virtually the same number who gave the strongest positive answer they could give at 29. So overall, an 8, 9, or 10, those at the top of the scale, that was 44%. And you can see here, again, in the Northeast, that top part of the scale gets as high as 54%. In the Midwest, it gets as low as 36%. But the opposed number doesn't get to 1 in 3 overall. So my conclusion is that we're dealing with an environment that is more favorable than one could think when you just pay attention to what the conversation is at the national and local level about what's happening with abortion rights. We asked about the importance of various issues in the campaign, just to put things into context, that there are other things like terrorism, gun laws that are more important to more people, that abortion, same-sex marriage, those used to be sort of the front and center things in campaigns, and they're not there now. But is this an issue that matters a lot to you? And in fact, 56% of our respondents said it mattered a lot. Well, who are they? Well, that includes 75% who are at that low end of the scale, the people who are most opposed, and 60% of those people who are at the high. So a little bit tilted more to the people in opposition, but still a strong proportion of that who are in the 8 to 10 range. And there are your regional numbers. So we set about then to test the model bill. So again, we're still in this clean read. They can't really judge what the tone or tilt or what's coming in the rest of this until we start to look at some model legislation. We tested 13 bills, although Bernie, you sort of qualified that, saying one isn't really a model bill, but it's a similar policy position. 12 out of the 13 are favored by a majority of likely voters, and that includes 8 that are strongly favored by at least half. And I don't think that we would have predicted that this would be the finding before we had data in hand. So let me just sort of walk us down the road. And I've put these in questionnaire order so you can look, again, you can see my abbreviated versions of the questions, and it's a lot more language that's there. This is the percent favoring overall is my first bar, and then by each of the regions there. In virtually every case, the one that pops is going to be the Northeast. But this is 84% who are in favor of pharmacies stocking and dispensing, being required to stock and dispense contraception. Emergency contraception for when a person reports a rape to authorities, that they must tell of the availability of that, slightly higher, less regional variation. And to promote programs that feature long-acting birth control, again, as a pregnancy prevention approach, 82% overall saying they favor that approach. 3 questions here that were about crisis pregnancy centers and their practices. So one was to basically make it illegal for them to falsely advertise so that women are getting the right information. They're not accidentally walking into a place that they think of as an abortion provider because it has advertised itself in a way that that's not completely clear. 62% say they favor that. A question about if, like regular offices post the state license to practice medicine for those providers in that office, that they would, crisis pregnancy centers would need to post a sign saying if they do not have a license to practice medicine. More favorable response to that. And providing false information such as saying that abortion is harmful and can cause cancer, among other things, should that be restricted, and 77% agree. They favor with that. It was at this point, after testing all of those, that we offered the people at the bottom end of our scale the chance to opt out, that we made it very clear, and here's the language that we offered, that what was about to follow were questions that had to do with proposals that would make abortion rarer, safer, or more accessible, that we want their opinion, but that if they decided to opt out, we would still have some demographic questions at the end. And this was our way of keeping people included in the base so that they didn't drop out and therefore artificially inflate support, because the people who were supportive were more willing to hang on the phone with us. In fact, our phone bank came back to us and said, we have some people, not a 1, 2, or 3, who still are beginning to get resistant, and can we offer them the opt-out? And we said, oh, of course. In overall, about 10% opted out of each of the subsequent questions. So here are the proposals that came after that opt-out option was offered. One was about having a bubble zone that would keep an 8-foot distance for women who are entering and exiting the clinic, as well as clinic staff. And you can see strong support for that, 81% overall, saying that that's what they want. Now, I want you to keep in mind that this 81% includes the people who opt out. So they've not been taken out in any way. They're still in the base, yet 81% favor that. Similar percent, 75%, say they do wish for employees not to be punished for health decisions, whether that is making the choice to have a child, making the choice to have an abortion, using contraception. Strong support for that. That there should be an opt-out availability for the woman at an abortion clinic, that she could decide if she wanted to opt out of required sonograms or waiting periods. To me, if she can opt out, there's kind of no point to having the law in the first place. But 60% said they found that something that they were in favor of, a strong signal that there's interest in making abortions more accessible and less of a burden to the women. 55% favoring that all insurance should cover abortion services, and that would include Medicaid as well. A strong spike in the Northeast on that particular item. Then there were some that were not as well received. This is the only bill that we tested that would allow people who had been harassed by protesters at abortion clinics to sue their harassers. This is the only one that failed to reach a 50% favor number. At 47%, it's still pretty close. Not sure. It may just be that people don't think lawsuits should be the first line of defense, or what's exactly there. But it's different from all the other items that we tested. Extending prescription privileges for medication abortions to nurses who have prescription privileges for other kinds of medicine, 60% favor that. And doing away with the delays or waiting periods so that there's not a burden placed on a woman seeking an abortion, 54% are in favor of that. So those are our 13 bills, and you can see that they were all testing with majority support. Now, they're tested in the way that the model bill would be proposed, which language includes some information about why that might be a benefit. Even so, you get a strong and consistent reaction to those model bills. The idea, if what you're looking for is to help state legislators feel confident in introducing those bills, these data would suggest that anything can happen afterwards, but that you're starting from a position of strength in terms of what you're offering being perceived as reasonable to the people who are going to be hearing about it. We also tested some messaging, and you can read this in the questionnaire. There's just different ways of making the case for why women should have more control and more say over their decision to have an abortion. That one focuses on the privacy of it because it is so complex. One focuses on that women should be the ones making their own decisions. One is about this is not a time for politicians to step in once a woman has decided that this is what she wants to do, and that every decision is different. You can never know what's behind anyone's decision to seek an abortion. And again, you see that at least half found each of those very convincing. So again, the strongest positive response that they could give to us. And really, not a whole lot of difference among each of those messages. But just to be sure, we came back around and said, well, which one of those do you find the most convincing? And, you know, the differences are really relatively minor. You have three that end up being about the same and one get at 12%, but it's not a huge amount of difference. And here you can see our opt-out people in there, so you understand very clearly they're included in the base. These numbers have not been artificially inflated. And by region, we went looking to see if there was some other way to take a look at all of this. Sorry, went a little too fast. And you just don't really see much regional variation. It's not like one message works especially well, but that much better in one region than another. We came back after all of this because sometimes when you've talked about an issue, it might induce people to change their opinion a little bit. And here's what we found, that we ended up still with about 2-to-1 who support increasing access to abortion over the people who oppose it. And that's a change that has mostly to do with the people who ended up opt-out. The greatest amount of change was in the people in the 1, 2, or 3 level, and very little change in the people who were on the supportive end of our scale. Here are the regions on that. Again, you see the Northeast being the strongest, the Midwest the lowest, on a par just about with the South and where those numbers had been before. So that's all good and well for the overall marketplace, but what about the people who really are the anti-abortion advocates? That is, they want to overturn Roe. How are they responding? What can we learn about how these model bills are working with the people who are the most opposed to abortion being legal at all? And what we found here is that for all of these bills that you can see here, at least half of the people who want to overturn Roe v. Wade say that they are in favor, and in many cases, as many as half strongly favor some of these model bills that clearly you just have to conclude that they find reasonable. And then there were those that were less. And these, to me, they fail to reach a halfway mark. These are the things that they were most opposed to. And to me, they sort of make sense with the people who want to overturn Roe v. Wade, that they're opposed to letting people opt out of sonograms and waiting periods, opposed to having insurance being required to cover abortion services. Here's that lawsuit about the protesters, opposed to more people dispensing and supervising Medicaid abortions, and opposed to doing away with the multiple appointments in the waiting periods. I mean, these are all many of these are the ways that the anti-abortion side has been successful in creating restrictions. So meaningful that they are discriminating between those model bills that they find acceptable and in fact favor, and those that are not aligned with their value system. So summing up, and then I'll turn this back over to Dave, this poll demonstrates very clearly that there's a breadth and depth of support for increasing access to abortion services, that these model bills, they don't just test well, they test very well, with that one exception. that the Northeast is most likely to show greater support, followed by the West, but really we saw support in every region. And that the messaging, sort of the bigger wordy packages of kind of explaining a rationale for promoting access to abortion, they all test as convincing. There's no clear one choice over the other, which gives local leaders latitude to decide what will work best for them. Dave?
Great, thank you very much. And like I said, stated at the beginning, I wanted to point out a couple of things. We have a number of folks who have joined us. If you should, on your control panel, you should see a handout attached. This is the top line data of a lot of the information that Anne's going over that encourage you to download and use that information to take away from this to help inform your work. And we really do want to use this opportunity to answer any questions that any of you have to ask of the pollster directly. So we have a few questions come in. There's a number of ways you can ask your questions. First, if you've got audio capabilities on your end, to click on the hand icon, and I'll get you in the queue as soon as possible. And you can type questions in the question bar. I know that people join us sometimes, and talking is not the best way to do that. And we have a few questions that are starting to come can come through. So let me read by some of these questions that have come through. And Jamie poses, what were the states that actually fell into these regional categories?
Oh, well,
what is the boundary line? Maybe that question is, I'm sure that there, probably from a state that often gets mixed in one or the other.
Right. It's going to be your normal way of dividing up the nation. I'm not going to trot through all 50 of them, but if you need us to send a map and make that available for download, we'd be happy to. Great.
Thank you. We had a question earlier from Melissa asking, was this an English only or poll, or was other languages incorporated?
It was English only.
Great. We have Sarah with Catholics for Choice. Why did you tease out the evangelical and did not notice any striking results from those, or did you notice any striking results from those in particular?
Do you still have my screen under control?
Yes, the screen is up yours. Yes, you can go back. Yep.
It's no longer mine?
No, it is yours. Yep. Yep. I see your screen.
So take it off with me, because I'm about to go look at some crosstabs.
Okay. That's the question. All right, hold on a second.
Yeah.
All right.
If the question was sort of noticing that we had a question that asked whether they were evangelical or born again Christians, it's something that we routinely ask, and maybe that's something to do with our being here in Iowa, where that is something that matters. My assistant Michelle is on the phone, and maybe she's got this already pulled up. But it's certainly something that might require a little bit more of an answer than I can give over the phone here in terms of taking a look at all of this.
Got it.
If there's another question while we're
doing it. Okay, so we'll come back to that. Thank you, Sarah. Hannah asked the question, did you see results change based on income or education?
One of the striking things is that there's a little bit of variation, as you would expect. And as I'm just kind of walking through here, just looking at born again, for example, in every case that I'm seeing, there are strong positive reactions. So I'm looking at one right now about protecting employees from being fired or punished for their health decisions. And that's among those that are evangelical, 55% strongly favor, 12% mostly favor. So what we went looking for is, are there particular groups that we should pay attention to that would be resistant? And it will come as no surprise that Republicans are less likely to say that they favor all of these. And again, that sort of is no surprise. But what we did find surprising is that when we looked at the strongest people in terms of their attitude on Roe v. Wade, that they were amazingly supportive of many of the model bills we tested.
Great. I have a question from Sabrina asking, do you have data separated by racial and ethnic groups available, part of this project?
I don't know that we ended up taking a look, parsing it out too finely. In our crosstabs, we did separate white from non-white. We didn't find consistent differences that were there. As is always the case in polls, getting granular on minorities is something that's often difficult to do, but it's something we obviously asked about in the questionnaire and could take a look on a case-by-case basis. We're happy to.
The next question, this is something that speaks, and they're running through. It's always great. We have a lot of people, but it's I'm just trying to manage the thematics of the questions. Shifting to some of the legislative ideas that were tested. Melissa asked the question, were people surprised to hear the law did not already cover or require a certain level of activity based on a lot of this, what the solutions were? Like, where were people's, where were the voters' general understanding to be able to make their informed decision? Can you speak to that?
Well, I guess at the beginning of that question you asked if people were surprised as we were reading these laws as to whether they were, this was something that already existed or not, or might have given some pushback there. We didn't hear that from our phone bank, and who might come back to us and say, gosh, this is taking a lot longer because people think these things already exist. It's more of a focus group question to kind of understand where that is. I think the takeaway that's really important is that regardless of whether and they didn't know, again, the sponsorship of this poll, that they could say they opposed if they thought it already existed. I mean, they could answer either way. The question didn't presume that they knew that this wasn't already in place, and in some states, some of these might well have already been in place. I hope that helps.
Trying to come at some of these other questions. Amy asking the question around the total demographics, and it seems that the data skews older. Is that because of phone lines? Are there other strategies to be able to reach to make sure this data is informed by millennials? Can you speak to?
So
can you speak to
that? I
sure
can, and let me be very clear about our method, which is complicated and a little technical, but you've asked the question, so bear with me. That is, when we call, we're calling from a list of random digit phone numbers into landlines and to cell phones, and we ask people if they then are likely voters, because that's who we're going to allow into the survey. And if you do not qualify as a likely voter, we still capture information on age, race, I think region, and are you male or female. Those are the variables we're going to weight to. So we have a bigger pool who are general population looks like that. And if you look at the very top of the questionnaire, you'll see we had 1,569 contacts, of whom 1,003 were likely voters. So we weight to the general population of census data by sex, age, race, and education attainment. And then from that large pool of 1,569, we pull out the likely voters. Now, if older people are more likely to be a likely voter, they're going to be a stronger percentage of that likely voter pool. But it is weighted to account for who's at home and who tends to answer the phone and all of that, so that we're dealing with, we start out with a true cross-section of the population and pull likely voters out from there. again, kind of complicated, but our goal is to get to what's true.
People came here just to learn about proactive abortion rights policy, and they came away with schooling and polling strategy.
I'm sorry about that. Yeah,
that's great. No, that's great.
This is my life.
Well, and again, I think it's we are so thankful for you sharing your expertise and really helping us try to digest and measure the support for these as we engage with other policymakers, trying to gauge like what's initial support, where these ideas start from, and this is incredibly helpful.
And you could hear in my explanation about introducing the opportunity for people to opt out that I was very focused on keeping a sample that is reflective of the population we're studying. So first of all, for the general population that we're going to use to weight the data. Secondly, for the likely voter pool, so that looks like a true cross-section. And thirdly, to keep people who might be opposed to these ideas in our base so that we weren't manufacturing a higher response than was true of the population. From the way we work with our clients is the best news we can give to you is our best shot at what is true. Because if we've somehow inflated something in a way that makes you happier, then when you actually walk out in the real world, it isn't going to work for you. And ultimately, you need as close as you can get to the truth and our best shot at that so that you know what you're working with, for good or for ill.
Right. This may also be, again, around the technical conversation. Morgan's asking this term likely voter, is it just that they say, yes, I vote? Or are there other factors used to determine a likely voter?
Our success has been built on a simplistic view of how to define a likely voter. And that is that we offer you 4 options, that you'll definitely vote, probably vote, might or might not vote, probably not vote, and only if you say definitely vote do we count you as a likely voter. There are people who can, in some states, register at the polls on election day. So starting with a registered voter base, to me, is potentially biasing by leaving out people who intend to vote. There are other polling organizations who build in a lot more in terms of, well, do you know where your polling place is? Have you voted in the past? And all of that, they've done a lot of statistical work based on past elections to predict future elections. And more than ever, we're living at a time that past elections have very little to say about our current election. And some of those pollsters have ended up with not very good track records. Gallup had a big problem and no longer releases horse race polls because of that. So our A+ rating from Nate Selzer comes because of our accuracy in the final polls that we have released ahead of numerous elections. So there may be a day where our approach to defining a likely voter doesn't work. It has worked for us so far.
In the polling results in its aggregate form, were there any surprises between male and female respondents?
You know, in virtually most cases, I don't know that this is a surprise, you have women who are more supportive sort of every step of the way. And sometimes it's a matter of a couple of points, and sometimes it's a matter of maybe 6 points or as many as 10 points. To me, that's not a surprise in that women align more democratic and align more with social issues in this way. So not a surprise, but was there a difference? In some cases, yes. But I'm looking at one right now, which was about crisis pregnancy centers. I'm just kind of a random one about not getting funding if they provide false information. It's 67% of women who favor it strongly, 61% of men, but it's made up for in the next most positive answer. So at the end of the day, it's 77% of men, 77% of women who strongly or mostly favor that idea, and you see that kind of consistently throughout.
Great. We asked, and this might be a better question for Bernie, to how we can help support everyone who's joining us. Amy also has a great question, particularly zeroing in on the bills that it was in some cases surprising how much support anti-abortion folks were of them. Um, is there a way that we can break that out? Everyone who's joining this presentation will be able to get a copy of this presentation that will be a link that will be shared with you. But there are actually a few people who have asked, is there a way to get that broken down? Because that it doesn't come out. Is not as highlighted or explicit in the PDF attachment that we have here. So, I mean, Bernie, I don't know if you want to address that, if we can synthesize that as something that would be helpful for people who are making that request.
Well, if someone wants a particular slice, if they'll email me, I'll see if we can't pull out that crosstab for them. Again, that's bhorn, BHORN, at publicleadershipinstitute.org. And you know, if it's possible, then I'm happy to try to do it.
Fantastic. All right, I think I got through most of the questions. If people have any further questions, you can type questions in the question bar or raise your hand if you have audio ability from wherever you're joining us. I mean, this really is one of those unique opportunities that the architect of the instrument that was used to get this information. I think very valuable information. It definitely is someone who spends most of my time engaging with policymakers and trying to get over get over the hurdle of getting a gauge of where public support for ideas are. Nicely captures the huge public support that exactly that's here. And so this is an opportunity to talk to Anne directly about, I mean, not only about the outcomes, but even the methodology to anticipate those questions that you might be asked about as sharing this information and advancing all of our collective work. And we have a question here from Kate. Can you go back over the opt-out process? There are actually a few other people that just also asked the question. Just going to be clarifying, like, how is the opt-out? How is it quantified? Do people actually opt out, and how many? I mean, in terms of based on the conversation of the proactive abortion rights policy.
Right. I'm happy to go over that again, and I'll just read it. The instruction in the questionnaire is that the following 3 sentences is to be read only to those people who answered a 1, 2, or 3 in the question that asked about the 10-point scale, where 1 meant they were completely opposed to abortion and 10 meant they were completely in favor of increasing access to abortion. Many of the remaining questions have to do with proposals that would make abortion rarer or safer or more accessible. We'd very much like your opinion for each. I'd also like you to know that you can decide to opt out of any of these questions. I will still have a few short demographic questions at the end, even if you do opt out. So again, the goal was to keep them in my base and not lose them, which would then inflate our numbers because the people sticking with us were already favorable to us. And for each of the model bills, it was either 10% or 11% who chose not to answer that question and chose that opt-out option. Relatively small.
But still counted as total, I mean, the assumption not supportive.
So they're not counted as not supportive. They're not, but they're certainly not. We didn't reduce the base. We didn't take them out of the question. They're still in there. So that makes clean those proportions who say they favor.
Right.
It doesn't assume that they would necessarily be opposed. And in fact, we had some people who gave a higher number who kind of got tired of the survey, and we offered them the opt-out option as well. So just again, to keep the integrity of our base intact.
Great. Karen asked the question, did any of your questions address the idea that legal access to abortion or Roe v. Wade is supported by a majority?
We wanted to capture that information, not disperse it. So
great, and that was pulled out.
Our job is to gather information, right?
Got it. So we didn't push that other.
No, and I think we have walked through literally every question in the survey. So, right, nothing has been left out that I can recall.
Okay. So Kate is asking, like in the top line tool, how someone who would opt out, how would they be coded?
They were coded as opt out.
Opt out.
So if you look,
I could have answered that question. I'm managing three things at once.
So if you look at question 9, for example, which was the first question after that was offered, you'll see that we give you the net favorable, net opposed, and then break that out into strongly favor, mostly opposed, strongly opposed. Oh, opt out. Here's the 10 or 11% to each of those. And then if somebody said, I just don't know, we code that as not sure. So those numbers, those final 6 numbers add to 100%, including the opt out.
Got it. Excellent. All right, and if people have any other further questions, we're going to probably be wrapping up. You can always reach us through the website publicleadershipinstitute.org. The purpose of this is this session here is to get this information into all of your hands and use it as a tool to help support advancing the overwhelmingly popular proactive abortion rights policy that's captured in the playbook, which again, you have your screen, and if you haven't, you don't have your own copy, you can download it from our website, publicleadershipinstitute.org. Again, like it was said, this presentation is recorded, and a link will be sent to everyone who is joining, so you'll be able to reach it that way. On your control panel, there is the top line. Be sure to download that before I conclude the presentation so that you have that information on your end at all times as well. And Anne, I don't know if you have any closing comments. I'll give the floor to you. Give that general, maybe restate the overall conclusion of what these results were.
Yeah,
and we'll wrap up with that.
Yeah, and I just want to thank everybody for their attention and for their really good questions, because sometimes people don't care about the technicality, and we think all day about the technicality. So happy to explain more of that. And I think, as Bernie said, there's more that will be available if you're interested. It was, like I said at the beginning, kind of listen to the idea of doing the survey with some trepidation about how to manage the complexity that is the abortion debate. I think the only other time I felt that there were lurking pitfalls that were numerous in quantity was chatting with some gun rights, gun control people about how we might measure various initiatives to do with that. It's just the topic has become so inflammatory that it's easy to take a misstep. So that we found a way with the we're using and looking at the ultimate goal, which was to find out if legislators were to introduce these bills, would there be initial public acceptance or initial public resistance, and found a remarkable level of support for these kinds of things. So I hope that what this has given you is a tool, one tool, in terms of moving some things forward in a way that maybe hasn't been done before. But I ultimately want you to trust that this is our best shot at giving you what is a true cross-section of the U.S. electorate this year.
Great. And Ann, thank you very much. On behalf of Public Leadership Institute, Gloria Totten and Ann Selzer, we really sought out the absolute best pollster in America, and we got it, and we've got data that I think is going to be at such tremendous help to make the case for a proactive strategy in advancing abortion rights across this country. Thank you everyone across the country for joining us. Like I said, that we will send a link to everybody. You'll have this entire presentation to be able to reference back to. If there are individual questions, please reach out. Bernie gave his email, bhorn@publicleadershipinstitute.org. Feel free to reach out to him, and be sure to download the top line data so that you have it. On chance that you missed that, you can also reach out and we'll make sure that's available to you as well. Thank you again, and thank you so much for all your hard work on this. This is incredibly helpful and useful.
My pleasure.
All right. Goodbye, everyone.